Hi, my name is Charlie Kauffunger, and this presentation is From Silos to Healthy and Happy, the Transformation at Adventist Health System. We're brought here today by our sponsor, Saba Software, and I'm going to be here with Hap. I'll introduce him in a second. But first, just to introduce myself, I'm the managing partner at the Educe Group. We are an implementation services provider for talent management software. A little bit about Saba. Saba was born from learning management, and now they are a full talent management suite. It is designed to be simple and straightforward with the end user in mind. It is a platform that's based on collaboration, and it's unified. There's a common underlying platform that links performance and talent and recruiting and social together. It is scalable, it is intelligent in the sense that it uses machine learning and can learn from the patterns in your organization to make recommendations that encourage and enable the development of others. It is a modern system, and this is tremendously important in the healthcare industry, not only because, just like every organization, the healthcare industry needs to develop and retain its staff, but we are talking here about saving lives and improving the situations when their customers, their patients are at their most vulnerable. They are improving and enabling their staff's ability to get to the outcomes and connect with the people through this most vulnerable moment. Adventist needs, just like all healthcare organizations, need high quality onboarding to make sure as they hire people, they get brought in, and they need efficiency. In today's world, in the healthcare organization, efficiency is at a premium, and we need scalable, repeatable processes and ways for people to learn exactly what they need to know to keep patients safe and operations efficient. With that, I will like to introduce you to Dr. Hap Aziz, who I've had the pleasure to be working with over the past year. Hap is leading the change at the Adventist Health System. And with that, I'd like to turn it over to Hap.
Thank you, Charlie, for teeing it up. Thank you, everyone, for being here. This is going to be a little bit of sharing with what we're going through at the Adventist Healthcare System. You'll notice some similarities with what is happening at your organization, be it healthcare or some other industry vertical, and I'm hoping there's some takeaways that you'll be able to leverage and put into practice. So first, a little bit about the Adventist Health System. We're the largest nonprofit healthcare provider in the United States. Depending on how you count our employees, we have either 80,000 on the low end to somewhere around 100,000 total employees across our facilities. And those are 44 hospital and our central offices facilities, so 45 facilities, a number of campuses, and that's across several states, ranging from the Southeast, Northeast, out to Colorado. And we have nearly 5 million patients, and we're a $10 billion a year revenue company. So that gives you a little bit of idea of size and scope of the organization, and it's an indicator of the challenges that we faced when we undertook this journey. So the agenda for today's presentation, I'll share a little bit about the history and strategic planning that went into determining that we would move to a new LMS and everything that goes around that. Talk about our LMS model evolution, what we are currently using, our legacy system, and what we are implementing now with the Saba tool. We'll have some infrastructure considerations that I'll want to cover, as well as some learning process considerations. I'll definitely want to talk about cultural transformation, and you'll really hear little bits of that sprinkled throughout the slides in the presentation. We'll cover a little bit about potential risks, and then there will be Q&A at the end. So first of all, how did the Adventist Health System get to where we are? And so I mentioned that we're 45 facilities altogether, including our corporate offices. We did much of our growth through mergers and acquisitions. And what that meant is the various facilities that came to be a part of the AHS family, they were individual, already existing and already operating companies on their own. And so they had all of their processes and practices in place before the merger, and that included learning. And what that meant was their learning teams had their own way of doing things. And what we did as a system is we strongly suggested that every facility that came on board with us would at least convert to the same LMS, which is our legacy LMS, and so everybody did that. However, they were running different instances of the LMS, and in many cases they were running with different versions of the same LMS, which makes it very difficult to do anything system-wide, and that was not a good place for us to be. So our leaders, in the process of their regular strategic planning, decided to make some changes. And some of the points that drove that decision for those changes were the needs for continual improvement of the patient experience. So a consistent single LMS that would be preferably cloud-based across all of our systems would serve that. We wanted best practices and a consistent learning culture. Again, if you're running multiple versions, even if it's the same LMS, but you're running multiple versions and you have multiple practices at multiple facilities, there is not going to be any consistent learning culture. So another way to address that is from the technology point of view and getting a single LMS on board. Certainly, we wanted to realize economies of scale, and that again is difficult with multiple LMSs, so getting a single cloud-based system would help. And then finally, we wanted a modern LMS, and that was just something, even if we had the same version of the same LMS, our legacy LMS implemented across the board, that wasn't a modern tool, and so we wanted to find that modern tool that would meet our needs. So there's a poll here that we had given at our presentation on the web. I think there were approximately 700 attendees, and they responded to the poll. And I will respond to this poll in terms of what the AHS perspective is, and certainly as you are listening to this presentation, you can give the answers consideration to what is going on at your organization. And there will be several questions sprinkled throughout the presentation. But this first question is, where are you in the LMS platform journey as an organization? So there's several choices here. You could have multiple LMSs, and your organization pretty much says to each their own, and that's fine with the way you operate. You could have multiple LMSs, but you're in the process of consolidating. That's where we are right now. We consider, even though we have the same tool, we consider it to be multiple LMSs because, again, different versions, different practices, different interfaces, and we are in the process of consolidating into Saba. You could be centralized, but challenged with the idea of consolidation, and that's something that I foresee in our future, that as we centralize our LMS operations, we'll get a little bit of pushback from our facilities during the cultural transformation piece where everybody learns to actually work together and apply best practices that will fit the entire organization, not just their particular facility. You could be centralized with a smooth process for consolidation. And if you're one of those blessed few organizations that are there, I envy you. But for most of us, I think, we're probably A through C or possibly E. Your situation is essentially the Hunger Games, and it's not a pretty sight. Sometimes I feel like we're there. So think to yourself, where are you in this journey? Again, we're at B, really. So the LMS model evolution that we're seeing and we're applying at AHS looks something like this. On the left-hand side, you see a slide, and you see individual facilities. Some have LMSs. They're different versions of the same platform, but still very different. And some of our facilities actually don't even have an LMS, and we do a lot of our training and education manually through live instructor training, and then we hand out paper-based tests, which is not a pretty sight. Where we want to be is represented by the picture on the right, the integrated model. And essentially, you see that all of our facilities are still separate. There's a central LMS at the core, And there are lines and arrows that depict not reporting structures or authorization lines, but rather lines of communication and collaboration. So each of our facilities still, the educators there are still able to serve the folks at their individual facilities, very, very much hands-on, but at the same time they can communicate with each other, collaborate, ask questions of each other, and learn from each other. And we want to leverage that power. So what does a learning culture look like? That question can have multiple answers. I think there are commonalities in those answers for most organizations. Specifically for AHS, looks something like this. We want to share challenges and address them together. So it's important for us to be able to merge our history and our data. Currently, we cannot do so because of the separate systems, and not only because the systems are separate, but because our legacy LMS is not even integrated with our HRIS. SABA will be. We want to have those open lines of communication, but those communications, that means more than just sharing reports. It also means social collaboration, the idea of social learning. That's something that we don't have with our legacy LMS, and it was a key consideration when we did the RFP and we selected SABA. So social learning is a piece, and that leads to the third item here, which is building cohorts. With social collaboration across our various facilities, we'll be able to have educators and learners communicate with each other as they go through their learning experiences. And as learning data tends to bear out, it's when people collaborate in their learning and actually communicate with each other that we have much greater retention of information, which you know, in every industry it's important, and in healthcare it's certainly important. We don't want people sort of dropping off or the information that they've learned to have a half-life. So we'll be looking at, I have two types of consideration here. One is infrastructure considerations that we'll talk about, which is in our current state and what we're looking for in future state, and we'll also talk about learning process considerations. But right now, for infrastructure considerations in our current state, and I've mentioned some of this just earlier, our LMSs are standalone and they're facilities-based. It's very isolated, doesn't allow for any of the economies of scale, collaboration, anything like that. There is no HRIS integration. In fact, there's not even something as basic as single sign-on, and that causes a tremendous amount of angst among our end users just by the fact that they lose their passwords or forget them or do whatever else, and it just is a barrier to enter the LMS. We do have those multiple LMS versions, and we don't have collaboration or shared support. So part of the challenge of having multiple LMS versions across the board is, from our perspective, we don't have the resources to provide support centrally to our facilities as we do with a lot of our other technologies. So our individual facilities, it's left to them to communicate with the vendor of the LMS, and we can't bring to bear the central organization in helping them out, and that's a tremendous loss for us. So what are we looking for in terms of future state? Basically, we want that system-wide LMS to be cloud-based, and we want that single version, and we'd actually like a version that's updated on a regular basis, which SABA sends out, or it has quarterly updates, which is very good. We know that we'll always be on the leading edge of the technology, if you remember that 21st century learning tool piece. We'll be integrated with our HRIS. That means we'll be able to pull employee data in instead of having to have manual imports, reducing the administrative burden on our facilities staff. That's something we want to take away so they can focus on learning, the learning activities. And then we basically want to have a single system of record for our learning, and SABA will be that for us. And we're confident, after having gone through an RFP process and actually having had the opportunity to beat up the tool in a sandbox environment for some time, that it will be able to meet these needs. So as far as learning process considerations go, current state, we don't have a consistent content development process pipeline, and that is if you know what the content development process should look like in an ideal world, take that away and you'll understand that we're in a very, very difficult position right now. And because of that, we also don't have a content approval process, which means there are multiple levels of content that get into the various LMSs. Some of it wonderful content, and some of it content that frankly we wish we didn't have to use, but because we're spreading our resources so thin, we're left with little choice to do so. We have multiple content rollout refresh cycles, and along with that, we have a lack of a system-wide content acquisition strategy. And then to top it all off, because every facility is running a different system, we don't have a consistent governance structure across the board. That is very painful, and it means that we cannot collaborate with leadership to get what we want across the system. So future state, we essentially want to correct all of these things. We want to have best practices for our content development process, new content approval processes that we can standardize across the system along with our content rollout and refresh cycles. We need to have a consistent content acquisition strategy so that we're buying licenses not for individual facilities, but for a system, which means we can realize some economies of scale, make our dollar go a little further. And then finally, we're able to address the governance issue by creating a learning subcommittee that will address all of our learning needs as one system. And that's something that leadership has bought into, and they're very active. And that's something that's a blessing to me and my learning team. So another poll question, what reports generate the most frustration for your learning teams? So A, we're talking about compliance. B, analyzing reports to assessments. C, registration. D, program status. E, all of the above. You know, I really want to answer E, all of the above, but honestly, because our reporting capability with our legacy LMS is so poor, A is the only one that we can actually fall under, compliance. Just essentially all we can find out is who has completed our training, which gets to this question, which is what can we report on today? That's about it. The number of people that have completed training modules. That's not a lot of data, and in many cases it's not even useful data. It gives us a number, but as far as metrics to report to leadership and drive change, it doesn't do a lot of good for us. So what would we like to measure in the future? Well, these are some of the basic things. There are more, but here's some of the pillars. We want to understand what our training and retention efficacy is. So are people remembering what they've actually taken in training so that we can have less frequent updates of training? We want to look at staff training effectiveness and engagement. How well are they actually being plugged into the content that they're learning, and how well do they put that into practice across the board? Certainly we want feedback on the content and the courses from our end users so we can do a continual refresh and improve cycle. And then, of course, we're going to continue to measure completions, but that's going to be part of a larger story, which is extremely important to us. So here's a poll. What are the barriers for transforming the learning culture at your organization? Staffing challenges, existing processes, reputation, investment, support, or change management? And you know, maybe there should be a G there, all of the above. But really, for us, it's B, a combination of B and C, existing processes that are hindered by our poor legacy LMS solution. And as a result of that, our legacy LMS has a really poor reputation. So it's very difficult to do any of those other things because of where we are with our current LMS. So what are some considerations and risks that we have as an organization? Well, there are operational concerns, of course. What's happening as we migrate into SABA from our legacy system? So those are some issues that we need to deal with. Basic training, communications, end user support. That's the bread and butter of a learning operation. There's the whole idea of business process mapping. That's how are we doing what we do now? How can we map that into the new tool? But perhaps more importantly, how can we use the functionality of the new tool to drive new business processes that improve the efficiency of our operation? And then the change in support service models. We're going from a model where our individual facilities reach out to a vendor independently, but because we're implementing SABA, we're actually creating a centralized learning department that I'm heading up, so we'll be able to support our folks internally. There's some risks on the side, the loss of LMS coverage during the transition. We want to minimize that. There may be longer development times for content and how we release that content because we'll be implementing standards. And as a result of the new standards that we want to implement, there may not be consistent as to what those standards should be, what those guidelines should be. We'll have some conversations there. Finally, we're looking at the potential expectations gap between our RFP criteria, what we wanted to get, and what we actually got. And the folks at SABA and the Educe Group are actually helping us to have those conversations. What does our cultural transformation process look like? It's this. We want to replace our LMS. We want to create social connectivity so that we can communicate across our facilities, and then that will lay the foundation for us to establish a framework for sharing content across our facilities. We need to establish best practices for learning, use of content, acquisition of content, measurement, metrics, assessment, and then finally we want to now, with a single system, leverage all of our resources to develop content together. It's very important for us. We want our rollout to match transformation. Two-stage rollout process. Stage one, it's essentially our pilot process. You can take a look at the elements there. And stage two, we will then be rolling out the LMS for all of our other facilities, all 44 remaining facilities, in about 8 or 9 groups together. So multiple facilities will be rolled out together. Those are some of the items there that are important to us, but really to me, I want to focus on both the big picture and the details to make sure that we have organizational health, and then we are pushing forward our learning vision and the resultant cultural transformation. Poll item, which big picture outcome matters most for your learning strategy? Improved patient experience, that's a little bit of a tongue twister. Easier delivery, accurate real-time reporting, increased retention, or opportunity for innovative new programs. For us, again, all of these are important, but it's improved patient experience that drives everything else. So all of those other items feed into that. So it's part of our strategic thinking that everything we do needs to drive improved patient experience. So what does the future look like for us? Improved patient experience, of course. The ability to report apples to apples across the board at all of our facilities, and then improved retention, both on a knowledge retention basis and staffing turnover basis. So those are some of the things that we're looking forward to towards the end of this year and into 2018. I thank you for your time.